I'd like to welcome everybody to today's CSOHIMSS Lunch and Learn webinar for June 14th. My name is Scott Mash. I am the past president and HIE liaison for the Central and Southern Ohio HIMSS chapter. Before we move to the today's speaker, who is John DiMaggio, CEO of BlueOrange Compliance, I would like to first share some information on the CSOHIMSS chapter. Now, when we get started with the presentation, if you have a question at any point in time, you can submit that question through the questions feature of GoToWebinar using the steps presented here. Then at the end, I will read all those questions to John, who will take the time to answer every single question that gets submitted. The handouts will be available on the CSOHIMSS website here in a few days. They're also available right now through the GoToWebinar handouts feature, but you'll see the CPHIM, CAHIM, CEU form. You get one CEU for attending today in the presentation slides. We are also recording this session, and the recording will be available on the CSOHIMSS YouTube channel. If you missed one of our previous CSOHIMSS Lunch and Learn webinars, you'll be able to just go to YouTube, type CSOHIMSS, and you'll see a recording of every single Lunch and Learn webinar we've done up to this point. If you would like to get in contact with any of the CSOHIMSS board members, you can use csohio.info@himschapter.org. That will go to most of the board. The csohio.president@himschapter.org will go to our president, who's currently Jeff Haas. And you can also find the address to the CSOHIMSS webpage here, where we try to keep everything up to date about upcoming Lunch and Learn webinars, upcoming events, and then share some general information about the chapter. We try to remain pretty active on social media. Follow us on Facebook and Twitter and LinkedIn. We could not do what we do as a HIMSS chapter without our sponsors. I'd like to thank our premier sponsors, our top level sponsors, which is Computer Associates, HPG, IBM Watson, Cover My Meds, Cisco, OnBase, and Nutanix. Also our elite level sponsors, which do include our presenter today, BlueOrange Compliance, also DMI, Vocera, Encore, Metasource, Leidos, Tech Systems, Spectrum Enterprise, ICG, RDI, Merge, DCA, IQSG, Obix, and Healthcare Integration Consulting Group. We do have a few events scheduled that I'd like to share a little bit of information about. Still pretty early for some of these events. We're still working to lock in a date for our 2017 Fall Conference. We do know it's going to be in Cincinnati. If you have an interesting topic to share, you need some experience as a presenter, let us know, because we're haven't really locked in on a single theme. We're trying to broaden our events a little more to give you a wider array of information rather than focusing on one narrow central theme. So if you are interested in presenting, let one of us know. Send me an email. I'll send you the call for speakers form. The 11th Annual Ohio Health Information Technology Day will take place April 25th, 2018 at the Ohio State House Atrium. Keep an eye on the CSOHIMSS website as details develop. Spring conference, same thing. We know it's going to take place Friday, May 18th at the conference center at OCLC, where we've had our last two spring conferences. We love that place. They treat us good. We've got a lot of space there, so go ahead and put a hold on your calendar for that day, and if you're interested in presenting, let me know. I'll send you the form. We have quite a few Lunch and Learn webinars coming up. We have one a month. Next month, we will have Implementing Successful Electronic Prior Authorization Solution. This will be presented by Ms. Caitlin Graham from Cover My Meds and Brian Colligan from Mercy Health. In August, we're going to hear from Mike Hurley at OnBase, Eliminating Facts for the Sharing of Clinical and Administrative Documents in Ohio in 12 Months. September, we're going to hear from Eagle Dream Health on competing on analytics using data analytics to drive success under the value-based payment system. In October, Crosschecks will be presenting Humans at Scale, How AI Can Affect Your Organization. November, December, we need speakers. If you have an interesting project that you'd like to share, if you need experience in presenting, please contact me. Let me know. These presentations, for those of you who are seeking a member advancement within the HIMSS organization, if you want to move to a senior HIMSS member or a fellow member, these presentations count towards the number of points that it takes to advance a membership. I myself am a HIMSS fellow, and I can tell you it takes a lot of work, a lot of dedication to HIMSS to move to that fellow, and this is one way that you can move towards that advancement. Same with January. We're already trying to get scheduled out through 2018 as well. So if you have a topic you want to share even out in the 2018, give me a call, send me an email. Now I am going to get Mr. John DiMaggio unmuted and make him our presenter. And again, John DiMaggio is the CEO of BlueOrange Compliance. John, I've got you unmuted. I can see your screen. It's yours, bud.
Can you hear me okay?
Yes, sir.
Excellent. Well, I'd like to thank everybody for spending your lunch hour listening to a presentation about cybersecurity, which is definitely a topic out on the forefront. This is a little bit about me. I spent most of my career as a chief information officer in healthcare, and I speak on the subject as well as some others around the country. Just a little about BlueOrange. We are Columbus-based. We do work with healthcare organizations around the country, helping with privacy, security, and all the things that you see there. So today, we're going to kind of talk about overview cybersecurity, talk about breaches, some risks. We are going to spend some time talking about HIPAA. HIPAA is not sexy. Cybersecurity is sexy. However, they are very related. So we'll get into that topic, talk about some techniques, some kind of real-world examples, what you can do to prevent, and a big topic is how to respond, because unfortunately it's not if, it's when. We'll get into some governance. So kind of to tee this up, the healthcare landscape, you've all been involved in high tech since 2010. So at breakneck speed, kind of going into electronic world, starting to move healthcare outside the four walls into homes, etc. And acute care, been going for meaningful use, incentives at a breakneck speed, obviously going through all the meaningful use stages. I know some of you out there, some of you we work with, have some long-term care, and then long-term care is actually kind of late to the game. We're part of meaningful use, but they are advancing quickly. If you look on the technology front, unbelievable advances in technology through that same time frame. Cloud, very likely that most of you have some type of footprint on the cloud. Everything is connected. You have watches, smart devices. You can do just about anything remotely that you can inside your organization. And if you look at healthcare, we are behind most of the other mature industries. We're talking about banking, insurance, some of the highly regulated industries that have been highly secure for a very long period of time. Because of the breakneck speed of getting healthcare into electronics, then we're a little bit behind the other industries. Long-term care is behind acute care, I mentioned that. And the value of a health record is magnitudes higher than, say, a credit card info. Why is that? A credit card can, if you steal a credit card, you can turn that off. If someone has access to your health record, that can actually be you. They have information about you, your financials, your diagnosis, and they can do a lot more damage. Hence, the information is a lot more valuable on the street. So you take all those things into consideration, breakneck speed, a lot of technology behind other industries, high value of information. Makes it a perfect storm. It makes it a great place for anyone who likes money to try to attack this industry. So talk about privacy and security, just slice that up a little bit. So we are going to talk about HIPAA some because if you're in the healthcare industry, very few exceptions, you're dealing with health information which actually is protected by laws and regulations by HIPAA, and HIPAA is broken into, I'll have a slide about that, basically 3 chunks for what we're talking about, privacy, security, and breach. We're going to talk a lot about security, but we're going to talk some about the other 2. A lot of enforcement out there. You probably can't go too long without seeing something about breaches and fines and penalties. OCR, which is a division of HHS, is the enforcement arm. CMS, most of you are involved in CMS, their enforcement arm for meaningful use, or who do the meaningful use audits. If you knowingly violate, take information in a kind of an evil way and try to sell it or do something bad with it, Department of Justice, state attorney generals all over the country are trained about this, as well as OIG. So we'll talk about kind of the threat buckets, right? So we've got outsiders, which most people associate with with security, which is bad people from the outside. Still talking about mostly associated with cybersecurity. But you have a lot of people on the inside that have a lot of access to information, and if they have bad intentions, they are a big risk as well, because basically they have a lot of access inside your organization. There's other things like human error, leaving a laptop in a car, forgetting to close off a firewall, and environmental, because security is also about availability. So some things in the environment that can make your systems inaccessible. So those are kind of the threat areas. We'll talk about some of the downsides of this, and how you can kind of get caught. We'll talk about audits a little bit. We'll talk about breaches. Another way that can kind of trigger investigation of your organization is by a complaint. Someone comes out of your organization, says these people aren't handling my health care in a proper way, et cetera, or someone from the inside. So there's a lot of ways that you can kind of have a magnifying glass on your organization. We'll talk a whole slide about consequences of the bad things that can happen. So this is almost 3 years old now. Back in 2014, IBM gave an official warning that your industry is under attack, right? So that was kind of the most first formal warning from the FBI that healthcare is under attack by bad people from the outside. And they were right, because these are just some breaches in 2016. There's a mix and match of some of these were cyber related. Some were paper falls off the back of a truck. Some involved a third party, but you can see that there's some high profile ones, some close to home here, Central Ohio Urology, which was a SQL injection. I'm not going to get very technical here, but we'll get more technical than the talks I give to CEOs and CFOs. But so you can see that and breaches are actually on the rise. But here, this is a list of the 2010 ones. So Ponemon has they do studies each year about breaches, and the percentage of cyber breaches is 50% for breaches reported in the last 2 years. That's up from 2015 and definitely up from 2011. So what does that mean is for the number of breaches, more and more of these are, cyber is the root cause. I think a lot of that is ransomware, et cetera, plus, the slides I just talked about, it's a ripe market if you're in this kind of business. Second leading cause is third-party partners. So many of you have business associates. There's a bunch of rules and regulations of how you treat those business associates, how you manage those, but that's the next largest sources by third parties. So this is the scary one, right? So the average number of days before a breach is detected is over 6 months. So what that means is by the time you detect a breach and it happened, that's how long a breach could have happened or is still going on. So there's unfortunately a high likelihood that maybe some of you on the phone could have one of these breaches that is going on. You have to be fairly sophisticated to know if a breach is occurring. auditing tools. I know many of you are from larger organizations, but kind of knowing who's at your network and kind of correlating different events to see if there's something bad going on. But that is a pretty scary stat that it takes that long from when it happens to when it's detected. So this is something from I thought was pretty cool. Krebs on security. It's a good read from a security standpoint, but these are, I guess, kind of the theory of cybersecurity, right? So if you connect it to the internet, someone will try to hack it. Okay, it's just if it's there, there's a lot of reasons. We'll go into the reasons why people hack things, and if it has any value, someone will try to steal it. It's just economics, I guess. And even if they steal something that doesn't have immediate value, someone will always buy it. Even if it's worth more, there's always buyers for this stuff, information. And whatever he sells it for is a lot less than what it's worth to the victim, or the healthcare organization, et cetera. And if you don't want to spend a small fraction to protect those, that you will be relieved of those assets. So that's kind of the theory of this, but it is very true. I mean, there's unfortunately the internet is a great thing, but it has some downsides, right? As far as there's things on there, especially if there's something at the end of that has some value. So this is a good way to kind of start this off. Okay, so now's the non-sexy HIPAA part of this, but let's look at the actual definition, and this is going to be throughout the presentation. The acquisition, disclosure of information is not permitted under HIPAA. So that is something accesses it. This is going to come into play when we talk about ransomware, because ransomware technically has access to the information to lock it. Now, whether it is so it is technically a breach. Whether it's a reportable breach, you have to go through the process of doing an assessment. But this, which we'll talk about, but this is the pure definition of a HIPAA breach. So these HIPAA slides are very important because since you are dealing with protected health information, and if there ever is a breach, usually there will be an investigation. A lot of times it's going to be how well you were following these regulations at the time of the breach, and having all these things in place. I'm going to spend a little bit of time talking about what that means. These are just who is. I usually do this for other types of healthcare organizations. If you're working in the hospital, or basically you provide and bill for healthcare service, you do it electronically. You're a healthcare provider and you're covered by HIPAA, and then you probably have business associates that you would trust with that information, have formal agreements. So basically, if you're on this call, you are most likely covered by HIPAA. So these are the three legs of HIPAA: the security rule, which is protecting electronic information; privacy, as far as patient rights and your responsibilities and making sure the information stays where it needs to be; and then breach. There's a whole set of breach regulations that really come into play if there is a breach, how to determine if it is one, notifying, mitigating, etc. And again, the reasons I bring these up is if there is an incident, you may be shine a light on these things to see how many of these things you have in place. There's also state regs, so your state regs are more stringent than they apply. So a lot of fines and penalties is just part of it. We'll get into the all the other kind of costs, but legal costs, etc. So, and this is the HIPAA audit protocol. So again, tying into if there ever is a breach. So I mean, a lot of organizations are, you can only protect your information so much, but moving to response, because again, it's not if, it's when. So making sure you have all the I's dotted, T's crossed when something happens, to make sure that you can prove you're showing what you're doing. I have a link of where this is, but this is the actual HIPAA audit protocol. Do you have policies and procedures? I mean, the regulations, and do they, and basically, do you have documentation? Because compliance is about meeting the federal expectations, implementing, and documenting. So that's my my little, and one more slide. This is kind of what the HIPAA audit protocol looks like. It's very detailed. Again, I have a link to where it is. It's out on the OCR website. So that's kind of the link between these. So so here, so what should you do? You absolutely want to protect your information, and you want to meet the regulations, and they're very related. The HIPAA security rule has many, it's kind of the basics of what you need to do to protect your information, all the way from a risk analysis and several different other things you need to put in place. So that's one of the most important things. But as you meet the regulations, you'll protect your information. So they're kind of hand in hand, especially being in healthcare, talking about regulated data. So I know there's some big organizations out there, some smaller organizations, but hey, I'm a little guy, so nobody's going to worry about me. So here's some examples of some practices. Fines, just an unencrypted thumb drive, didn't do what they were supposed to be doing, right? Didn't have an analysis and risk analysis done at the time. And so then you go in the penalty box, and they call it a corrective action plan, just means you're answering to the government for a couple of years. It's another example. This is more of a business associate relationship. This is lost a thumb drive. Not quite a cyber event, but there's only 412 residents on it. But again, at the time, they weren't doing what they were supposed to, and they got a $650,000 fine. And this is, again, a statement that independent of size, this is important. So these are all examples of, it doesn't matter how big you are. If you have a breach, large or small, it could mean some bad things for you. And this is another one of just actually a paper issue. So now we're going to talk about kind of moving to the cyber thing. I thought it was important to list those things out because those are all part of this deal, making sure you're complying with all the regulations, because something that you could be called upon to prove. So downsides for cyber risk. So business disruption. So we see that with ransomware. Files are locked. We can't access information. Denial of service attack. Downtime is very expensive. All of these have some type of financial component. If you have a breach, HIPAA violation, investigations, fines, and penalties, breach can cost upwards of $2 million, all in. Civil litigation, if there's something that happens and a group of folks get together and can prove harm, could be lawsuits there. One of the biggest things is your reputation. You want to be, if you're going to be in the newspaper, be in that for a good reason. Individual notification costs. And I'm going to talk about cybersecurity, cyber insurance. But I know that a lot of these things are covered technically under cyber insurance, but that's making sure that you look at your limits and stuff. So I'll talk about that in a little bit. Legal expenses. If you're going to get lawyers to defend you in something like this, they are not cheap. And then obviously, fixing your environment. So there's a lot of downsides to this. So we're going to talk in general here. What are, if you're in the cyber, cyber attack business, there are best practices, just like anything else in business. So first of all, what motivates these guys? Money, obviously, ransom, getting information, selling it. Some people do it for fun. The social political cause, that was, when I do these presentations, that was always kind of also ran, except right now you're talking about elections and things is as far as a motivator. And some is just information. They just want to know about a company, maybe their IP, their customer list. So you're all sitting on very confidential information in addition to the information about your patient's residence. So the way this works is, classically, they're going to case the place, right? They're going to find as much out of your organization as possible. Right now, there's treasure troves of information about your organization through LinkedIn, Google, all different types of places they can know by looking at your staff and positions, what kind of technology you use, et cetera. Then they're going to scan, which is they're going to kind of check your perimeter, find out kind of where your weaknesses are. We'll talk about these in kind of more detail. Then they want to get in. So once they're in, they want to stay in. And once they leave, they want to make sure that there's no evidence that they were there, and especially to point it to the actual person or organization that is actually conducting this. So from an analogy standpoint, everybody you probably live someplace, a house or apartment. So someone wants to break in. They drive by your house and see when you're out, or if you put something on Facebook that's saying, "Hey, I'm going to be out on vacation 4 weeks. I hope somebody gets my mail." That's another way to do it. And if someone's hacking, you're going to look LinkedIn, Google, look for email addresses, who's who might have the keys to the store from an IT standpoint in your organization. That's where the Aetna breach happened, to kind of do the spear phishing and got to some high-level IT administrators. Scanning, if you're looking at a house, they might jiggle your doors and windows, find something's not locked. Then they're scanning ports. They might actually do phone calls to your organization and ask for some information. Humans are very, they want to please, and you ask for information they want to give out. Unfortunately, some of the information could come back to haunt you. So could try phone calls, could try to walk through your organization. I mean, usually in organizations, if you have a clipboard and a tie, you can kind of get anywhere in an organization. So that'd be another way to kind of scan. Okay, so you found your weaknesses. Now in your house, you're going to open the window. Now I know your weaknesses. I'm going to try to do a phishing or spear phishing. We'll talk about those. Inject some malware, or use some kind of other social technique to gain access. I'm in your house. I want to come back, so I'm going to add a garage code or garage door code, or find a spare key. Technically, create a backdoor, create a user that maybe is a way to get back in, and obviously, once you want to get out of your house, you dust for prints, clear out audit logs. So that's like an analogy of how a hacker would, burglar work in your house to hacker trying to get into your organization. So we're going to talk a little about social engineering, kind of on the forefront. We're going to talk a little about phishing, spear phishing, and whaling. These are kind of three popular ones. Phishing is more of a numbers game. So I'm going to send out 10,000 emails that all say your FedEx package is ready. Please click here, right? So numbers game is, hey, if I send out 10,000 and I get 500 back, I'll do that all day, right? And it's usually sent in blast, usually to all kinds of people who will click on something and then obviously insert malware or ask for information to get to more of your information. Spear phishing is targeted. So we're going to look at an organization and find out who's who, and then try to craft some messages that will be very tough to decipher if they're from the outside or actually from somewhere inside your organization. These are more the effective ones that are happening right now to get into your organization. Trying to get the people again who have the right access, and we'll talk about whaling in a little bit, which is trying to trick your C-level folks to wiring money when they're not supposed to. So ransomware is a big thing right now. It is malware, bad software. Get it a variety of ways. So emails, ads, files. It will encrypt files, which means that it will scramble them in a way that is that you can't get at them, and actually no one can get at them the way they're encrypted. And usually they will demand information to get the key back, kind of on your own. If you think that sometimes that works, sometimes it doesn't, but usually no data is stolen. Now this is going to come in when we talk about that ransomware is technically a breach. So as part of your breach risk assessment that you have to do, you have to kind of look at the strain of it and determine that there's very low likelihood that data was stolen. So which that's a whole kind of science in itself. So talk about some countermeasures, but for here, train your staff. Don't click on things. There's actually some good technical things as far as from a domain. If you're whoever administers your email, if you can at least mark that I see a lot of organizations doing this, mark that the email came from an external source. So if someone gets a email from the quote CEO and it says external on it, you'll know that it came from outside. Plus it gives everybody a little bit better scrutiny over some of the emails. The best way to recover from this is having a great backups. The clients and folks that recover from this successfully have a great backup that is not connected, because ransomware gets in there, it will encrypt anything that it can get its hands on. So if your backup is available, if you have file shares out there, it'll go through and try to encrypt and then actually move to the next machine. So lowest system privileges. This is I know some it's very easy when you get a new system to be the local admin of a Windows box, and that's great. It's easy, but the lower system privileges that you have, the better. It kind of prevents certain things from getting installed. And if you are an administrator, you should create a separate account, go into your administrator stuff, and then kind of back out. Because if you're doing day-to-day stuff, you have a lot of access. That's a way for somebody to get access. And then keep your system and antivirus up to date. So WannaCry, that was the new ransomware that came out. It came in through phishing, ransom, and this one exploited very unpatched Windows devices. So there was a patch done on Windows back in March. If you had that patch, you were covered. If you had non-patched systems out there, I know still a lot of people have XP in Windows 2003. There were no patches for that. It actually triggered Microsoft to actually send out patches for those. Actually, just today they found there was another exploit that was detected past that patch. So I think they just issued patches for XP and 2003 for another way for WannaCry to get in. So that was a little about the WannaCry strain of ransomware. Whaling. A lot of organizations actually have encountered this. So this is, again, a lot of reconnaissance done in an organization. So who are the CEO, who's the CFO, who are their vendors? It could be, hey, they deal a lot with a bank, or they do mergers and acquisitions with this equity firm. Hey, see, this is this is a firm, or this is from a CEO. Hey, we need to wire $100,000 out before 3 o'clock, or the deal's not going to go through, right? So that will trigger a lot of times, unfortunately, wiring money. So it's usually through email, and there's usually a sense of urgency. And countermeasures. Train your folks. Follow your own policies and procedures. So if you have a policy and procedure that says anything over X amount needs a physical signature from a CEO or CFO, you want to follow those as well. So that's a little about whaling. So technical attack details. This is in general how it works, right? So gaining access to the network. So the first thing is getting on someone's network. That's the first step. So that could be through a phish, which we talked about. They could hop on, get onto your network from a wireless vulnerabilities. Wireless not secure. There's a lot of ways to actually break in, get into your network from wireless. Web-facing applications. So you have an app on your website, either through an injection or something, allow someone to get into your network. There's a number of ways someone can get on your network, etc. So, but that's usually the first step to working their way through your organization. So once they're in, kind of passively listen to traffic. So I'm in. I don't want to get caught, but I'm going to try to look around, watch some network traffic going by, what type of traffic it is. That will lead you to a lot of times where to go next. So we're going to talk about something called pivoting, which is a technique we'll talk about here. Pivoting. So pivoting is, you can think of an example of you get beamed into a building. So now I'm standing on a floor, and there's a door to my left, there's doors down the hall, there's a hallway, there's an elevator. I'm going to open this door and see how far I can get. And if there's nothing there, then I go back out and I try a different door. Same thing with this. First, try to steal passwords. So a lot of ways. Passwords, easy passwords are easy to steal and track. Look for traffic. There's a thing called a hash, which is an encrypted code of your password. You can bump that up against these black market databases, which have a username, have a hash and password pairs. So that's the way that that easy passwords are stolen from you. And again, with a building analogy, I'm going to go. I see a staircase. I'm going to go down. Oh, now there are some doors over here. You go to a place, see how far you can get. and that might give you information to get other places. So you come back out and try a different door. So how that's done is going to depend once they kind of get on your network of what to do. And that's where I think a lot of the vulnerabilities can be. And then gain access to file shares. So if someone has your password and you have access to EHRs, they can get into there. I've had a lot of instances where a user had access to a file share and the organization didn't know that everyone had access to it, and it led to more files, et cetera. So try to get as much information and come back out. And then kind of at the end, a lot of times you don't even need domain admin password to get access to these EHRs, but there are several techniques that allow someone to see who has domain admin, are those machines up and listening. So to remember, there's a lot of these tools and software tools and techniques. They're all open source. They're all out there. So it's not like you need to invest in certain software to be able to do this. A lot of stuff is out there. So that's why there's so many people, and the good ones are successful at this. So we actually do one of the things we do is penetration tests, and these are some kind of scary stats. So 15 to 20% is if we send phishing emails out, sometimes it'll say, hey, we're from I'm the CIO, and we're implementing a new help desk system. We want to verify your username and password. So a scary 15 to 25% of those users actually fork over their credentials. Very scary. In 15 to 20 minutes, actually listening to traffic, we usually get several passwords electronically cracked. These are ones that are weak and are out there. Either maybe your password for Yahoo or something got stolen and you use it at work. Passwords cracked. The most popular bad ones are actually the season and the year. So you want to, if you have something that says summer 17, you probably want to change that. So, and then in about 3 hours, once we start, we can usually get a domain admin credentials, which is again scary. And then 30, 60 minutes, we're usually taking screenshots of EMR. So if that's that easy. It can be that easy in an organization, and I've got some kind of real world examples. These are not in order, unfortunately. So we'll start with example 2, I guess. We sent some phishing out and got a couple accounts, and when we had access to those accounts, we found a script that include all local admin credentials. Now, the scary thing about this script was it was something that was about 10 years old, so it's probably predates the staff that was in there, but this thing still existed and had all these credential pairs. So then we used that to harvest domain admin credentials. So this first one went through, cracked some passwords, found a workstation, and again found a file with username password pairs. Others where we found file shares that they didn't know were set up to be shared, etc. So these are fairly straightforward. These are decent organizations, and again to show you kind of how easy it is to get in. So first of all, you want to try to keep your defenses up to prevent this, but if it does happen, how to respond, right? The response side. So here's kind of a short list of vulnerabilities, right? So software patches. A lot of users, there's a Windows update, I'm going to put it off. Stay with those patches. The software companies are kept up on vulnerabilities. A lot of times their vulnerabilities are before there's a patch put out, but keep software patches. Open ports, we see open ports on firewalls, etc. Close off anything that's not required. Your wireless, again, looking at your access points, etc. Weak passwords, we talked about those. We see some unmanaged accounts, where some account that's needed to have to access some application, and it has a kind of a password in there. Default accounts, so could be some equipment that comes with an admin account, and sometimes I forget to change that. your mobile devices. Humans, password sharing, don't share your passwords. Obviously, password complexity and length is very important. Phone skills. So if someone calls, you don't have to tell them everything they ask for. Don't click on links. Another way into your organization is someone kind of walks in and kind of plugs in, right? So are your ports hot? This would be also from an insider standpoint. How far could an insider get in your organization to, to try to just keep the information to what that person needs to do their job is really kind of what you want to do. And then, like I said, visitor management, a tie in a clipboard. This is really important in your data center or wiring closet and stuff to make sure those things are locked. No one goes in there unescorted, who goes in and out. That's a very easy way to have someone get very easy access to a lot of your information. So, so from a security standpoint, you want to do these risk analysis, right, regularly. You can't just do one and done because things change, your business changes, technology changes, etc. You want to have always a plan. There's always things to do, right, of things you need to fix. Fix those things and kind of do that over and over again. I'm going to talk about vulnerability scans and penetration tests on another slide here. Train. You've got to train your workforce. Train your IT staff on a lot of this stuff as well. This stuff, changes. There's new vulnerabilities, new attacks. Make sure those guys are trained. And then all this stuff, this is all part of risk management. I mean, you don't have to do any of this, and all your information could go. And if that's something, a risk that you're going to, organizations are going to live with, that's fine. But this should not just be an IT thing that you have to worry about out of your budget. It is a risk to the entire company. So getting that the executive team educated. We have a lot of board of directors now. They're asking the executive team, "Hey, I see all the cyber stuff in the news. Are we covered and protected?" So that's from a security standpoint. We talked about vulnerability scans. So vulnerability scans, many of you might do those or do those regularly. That's a technical process where it's looking at your systems to make sure, to see if there's any software that's out of date, any open ports, any default accounts that are out there, any known vulnerabilities it'll try to find. If not, won't tell you about every weakness. It doesn't scan the vulnerabilities of your people to see if they'll click on something. But again, this is a great way to at least look at your technical vulnerabilities so you can patch those up. Penetration test. This is something we recommend doing after you've done some scanning and kind of closed off your doors and windows. It's kind of like your house. If you know your doors and windows are not locked, paying someone to see if they can break into your house is kind of a waste of resources, right? But once you get to the point where you think things are pretty tight, then it is a good idea to see if there is some way for anyone to get into it. A couple different flavors of these. A black box would be, I want you to break into my organization, and I'm not going to tell you anything. So you're going to be on the outside, and you have to kind of go through and go to Google and all the things that all these other folks would get to try to see how far you can get in your organization. That has its pros and cons. White box is, we're going to assume someone has those skills to get onto my network. I want to find out once they get in how far they can get. So that you have some knowledge about the organization from a white box standpoint. Again, there's pros and cons to both of those, but there are some other good techniques from a prevention standpoint. So when it happens, not if, it's when, and very good likelihood in your careers that something like this will happen. Looking at making sure all your ducks in a row, all your HIPAA stuff is, you have an assessment, you have policies and procedures on the privacy, security, and breach. Incident response is actually part of HIPAA security. So having incident response, a breach will definitely be an incident, but if you have good incident response, you can maybe see if there's things that you can kind of connect the dots that leads to their someone's been trying to come in and do bad things. Breach response, once there's an incident, security incident should all go into this kind of a breach funnel, so you can kind of go through the process, and is it a breach or no breach? If it is a breach, you have to go notification depending on the size of it. And also cyber insurance. I know probably most of you have cyber insurance. I have actually a slide on that, but having cyber insurance isn't the end all. A lot of times there's some applications which I'll go through which ask a lot of questions of all the stuff I just covered. It's pretty easy to kind of go through and say yes, 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 yes. But if something does happen, you want to make sure you answer that honestly, because there's been instances of someone actually does need it and found out that they really didn't have these things in place that they answered on their cyber application. So OCR's been giving some guidance out there. I have a link of where they're on their website. This is an infographic that they recently did about if there's a cyber attack, respond. So get your contingency planning in place, all your mitigation procedures to respond and mitigate the risk as soon as possible. Report it to criminal law enforcement. It could be FBI, local law enforcement. Report a threat to the right federal agency so they can get that word of the threat out there. And because I'm talking to information technology professionals, I have a if then else. So if it is a breach, you have to report it, or else you document that you went through and it wasn't a breach. So keeping documentation, and there's a whole set of breach policies and procedures that you should have handy to kind of walk you through this. We talk about cyber insurance. This is a sample application. And you can see here, information security policies, web server security, virus protection, mobile device, business continuity, all the things that I talked about previously. So, these cyber insurance folks aren't, they want to make sure they know if they have a good risk on their hands or not. So, so you really can't, one tempting thing is I'm not going to invest in protecting, I'll just get cyber insurance to hedge. Well, these guys are asking all these questions anyway. And it's super important when you get cyber insurance, look at your exclusions and your limits. A lot of times, a lot of things are excluded that may happen and find out that the policy doesn't pay. So make sure you take a good look at that. Governance is very important. So 2 federally mandated positions are HIPAA Security and Privacy Officer. You should at least have them named. They should have job descriptions. You should have a compliance committee that allows those folks to talk and work through with management. Executive should be on executive committees, agenda items, and should communicate with your board. Frequently, we go to present to boards, et cetera, who are very interested in how the organization is doing that. And also your cyber insurance carrier. Here's some additional things. We have a couple of ebooks on our website. OCR Cyber Guidance, that infographics, well, other stuff is on there. The OCR Audit Protocol is very detailed, but it's not a bad idea to take a look at that and see how you might fare if someone actually did an audit on your organization. And then there's the HIPAA, they call it the wall of shame, but it has all the latest breaches and some of the resolution agreements for fines and penalties. So here's some questions I usually start with. So have you performed the analysis? Do you have policies and procedures? Are they updated? Are you training? So these are some things you can go back and ask your staff as well. Cyber security is a subset of information security, a subset actually of the HIPAA stuff as well. So cyber is about keeping bad people from the outside out, but there's a lot of other things that you need to take into consideration. So and then that is all I have. So hopefully kind of gave you a good overview. I wasn't able to, with the time, to dive into too many details, but hopefully for the technical crowd, I got a little bit more technical than I usually do. So at this point, I'll open it up to questions.
All right, first question. Does your company allow students to shadow someone in your company, or do you have internship programs? This question came from a student in one of the HIT programs here in Ohio.
Yes, absolutely. So there's my contact info.
Okay. Next question is, how is the emergency preparedness programs or regulation related to or linked to the security risk assessment?
They are related. This is, a cyber attack or incident is considered in that bucket. So that's, I guess, my answer to that.
Okay. And does your company offer services to assist organizations that are struggling with the creation of their emergency preparedness plans?
Yes.
Okay, let me see. We'll check one other spot for questions. John, that was the last question, buddy. I really appreciate you serving as a presenter. Thank you very much. To our attendees, please get registered for our future Lunch and Learn webinars. Again, a recording will be available in the next couple days on the CSOHIMSS website.